All cool beans. This is Dr. Mobeen Sayed. So let's talk a few things. So one, I want to show you my first ever 8-second animation. And other than the bird and the bird bird poop sound, the rest of the sounds are mine. So I'm so proud of it. The 8 seconds. So I want to play that for you. 1 second. I'll tell you a story as well. So I just saw story time. Anna said so. One story as well, and then I want to answer some questions as well from YouTube and from Twitter. So let's do that. So let's start. I'm going to share my screen. Ready? So check this out. I still remember I sat down in front at my dinner table and I made this sound that this little dude is. So I wanted to ask you, can you name these two things, the small one and the big one? Okay, I'm gonna play it. So even that little whistle and was my sound. So I'm so proud of that. So that is that. Yes, Jim, I am back. Thank you. Gift. Yes, I'm back. Dr. Z says, "Oh no, I said however you wish." I'm happy to be here. Story time. So I'm gonna tell you a fun story. Doug says, "I can't believe I beat Algebra Bean." Jean says, "Take the night off." I will go off a little earlier. So let's do it. So Denise, you said that come back. So here I am, dude and dudette, and my parrot whistled back. Really, your parrot actually whistled back? That is so funny. So if I did this, so this is for the parrot. Nobody else gets any ideas. Would he whistle back? Okay, so Bip and Bop. That's a nice name, Bip and Bop. Big Un and Little Un. I like that too. So I think I'm going to do a survey on the names to see which one get more vote. Denise says bird poop. Yes. So okay, tiny duck mouse. Yeah, I'm still working with the tiny duck mouse. I didn't buy another. That's a nice name. Laverne and Shirley. Laverne and Shirley. I like that. Bip and Bob. Macrophage. I like that too. Okay, so let's have a quick story. This story I have actually been meaning to draw this, but now that you are asking for a story, here it is. So here is the story. Story is when I was young, my age will be um, so my mother had recently gotten separated. I was 6 years at that time. So then we moved into this place. So maybe I was 9 years, 8 or 9 years, so young. So let's say this was our home. What used to happen in those days, and plus we, because our family was broken and so we were not very rich at that time, um, we didn't have any refrigerators, and this is, I'm talking about 70s. So what used to happen was that milk was a part of a dinner and a part of the morning, and tea used to be there, or milk based things. So what used to happen was almost in every street, every neighborhood, somewhere on a corner, there used to be a milkman's place where there were cows, and I do not know how to draw a cow. So this is the cow, where there were cows, and then there would be, the milkman would sit here. And so what they would do is every evening and every morning, the milkman would milk the cows, and then they would bring that milk over here and put it there to sell. So what you do is, for dinner or for the morning, if it is cooler outside during the night, you would go all the way to the milkman, and you would bring your little milk container, and you would say, give me 1 liter milk or 2 liter milk or something. And you would pay them, you get the milk, you bring it back. The women in the house are now waiting for the milk to arrive, and then they would make tea from it and use it in the dinner or other things with the milk, or put it for the morning, so you don't have to run to go get milk in the morning. So I used to be the one who used to go get milk in the evening. And so, 8, 9 years of age, I would pick up my little container every evening. I'll walk, go here, give him the container, the milkman. He would put a couple of liters or whatever, and then I'll come back. And that's the routine. Now, one day, I saw that there was a little girl who was also going for milk. And she had her little container in her hand, and she was going for the milk as well. And so, fine, she's going for the milk, and I'm going for the milk as well. And so, I saw her 1 day, 2 days. So, one day I asked her, I said, what is your name? And she said, my name is Maruch. And I had never heard this name before. Of course, I'm 8 to 9 years. So, Maruch, Maruch, that was her name. So, we both kind of talked, and we went together to get the milk. And then um, on the way back, Maruch just kept going towards her home, and I went in here. And when I went in, I told my mom, I said, today I had a friend, her name is Maruch. And then I asked my mother, I said, what does Maruch mean? And my mother said, Maruch means someone with the face of the moon. Mah means moon, and Ruch means face. So my little brain went, oh wow, her face is like a moon. So I just became so enamored with the idea of her face being a moon. So now I would wait the next day. I'll sit here till Maruch would come, and then when she is moving to then I would join her as well, and we'll go together and we'll bring the milk. So 1 or 2 days like this, and we kept talking. And then one day what happened was, Maruk and I went together. We got the milk, and then on the way back, I did not go to my home. I just kept my container with me, and we both walked. And this is us walking. We both walked and walked and walked. And Maruk's house was, you go this street, and then you go this, and then somewhere over here was her house. So I went to Maruk's house. And then we put our milk on the side, and we started playing. So we were both young and little. So we had those little trucks and stuff. And so we started playing. A few hours later, Maruk's mother came in, and she said to me, she said, Mubin, she asked me, what is your name and where do you live and who's your parents and blah. And then she said, it is too late. You should go back home. Now remember, this is evening time already, that you go get the milk for dinner. So imagine you go out for dinner, milk for dinner, and usually you come back in 10 minutes, and now you have disappeared for 2 hours. So here in my home, what was happening was, my uncle, my mother's brother, he came back from the office. The milk was supposed to be there for tea and everything and dinner. And now Mubin is not there and milk is not there. And my mother is crying, and my uncle is back home, and he's saying, why are you crying? And my mother said, Mubin never came back. He went out. We have seen everywhere in the street. He's not there. The milkman says that he took the container and the milk, and he went back home, and he never reached here. So imagine now, they have no clue where I am. And for 2, 3 hours in the dark of the night, they just kept looking around. And when Maruk's mother asked me to go back now, I started just coming back with my container. And now, as soon as I turned back to my street, my whole family and the neighbors and the whole world was looking for me. And then there were yells and screams as, oh, Mubin, there he is. And then they brought me back in. Of course, the milk was not the bigger problem. I was. So I was correctly disciplined and punished enough that I would never go to Maruf's home again without telling. And that is the Maruf story. Okay. So so this is the story. I got beaten up. So back here. Now let's answer some questions. So the question here, what are your thoughts? So Richard says, what are your thoughts on Uttar Pradesh? Also, what are the three best performing places in the world currently, and what are the three worst? So, Richard, if I can keep this question for tomorrow, I would actually look at the places and then maybe able to answer those better. The science has become so confusing at this time, even for the people in the science, that Uttar Pradesh now, a bunch of people say this is ivermectin, and they have all the data and they connect it and they say, here, look, here are the graphs and ivermectin, and here is the result. And a bunch of people make fun of them and say, how is this ivermectin? So, excuse me. So there's a lot of um, positioning from both hands. The right thing to do is to actually look at the data itself. So I would look at the data. I had stayed away from this just because of all of this um, positioning that was going on. Griffin Lawrence says, I don't know if the research info has been released, but have you looked at the COVAX 19 vaccine created by Vaccine yet? If no, not yet, but I intend to talk about them. There are a few things. Number one, the VaxArts vaccine, COVAX vaccine. COVAX I've talked about once before, but I want to see their efficacy. And then Engenic vaccine, their team is joining us for a live chat as well. So I intend to talk more about these vaccines. Can you compare COVID 19 to RSV in young children? Hospitalization data suggests RSV is still more dangerous. It is possible. COVID is actually interesting. Fortunately, it is less aggressive with the children. Again, if I catch your drift, you may be saying that, hey, we should not go for vaccines or should not push for them if it is not even as dangerous as RSV. So, this is one area I have always kept myself very, very um, quiet about this issue because I am a little sensitive towards children. It is really children, their parents, their community, their doctors. They have to decide what is the best for them. I don't want to jump into this because I cannot openly discuss this because of my own reasons. John Snyder says I like the old office. So John, how about this new bookshelf? And now, do you feel better? And Lisa, what do you think? Do you like it? Okay, so with this, I'm going to go here as well. Can you discuss the Vaxart COVID vaccine? Yes, I would do that. How effective do you think povidone iodine nasal and oral sterilization is during early infection? Could it be effective at reducing viral load and warding off cytokine storm, or is it more of the virtual treatment? So, Shams Jenner, there was one study from Malaysia in which they had discussed the oral rinses, Listerines, mouthwashes, and compared if they had helped with the reduction in virus load. So, in theory, from a mechanism point of view, there is a possibility of reducing virus load and keeping you a little more healthy. At the same time, if you go to Listerine's site, they say it that, hey, don't take Listerine as anti-COVID because it would not help, and that they're correct. I mean, if somebody has COVID or something and they take Listerine gargles, it would not magically cure it because the COVID has entered the cells and now it is breaking the cells and going deeper. Listerine cannot chase it all around, but it would still try to do a good job of trying to keep the oral cavity and some part of the nasal area cleaner. So my thinking is that it would help reduce the viral load, which, if it is in the beginning, will be very important for how the disease will progress. This is, I believe, the same mechanism or same thought behind the sanitize from Canada. Sanitize, I think, is approved in Israel and UK. There, this is a nitric oxide based nasal spray. And what they say is that keep it with you, and if you feel you are exposed, immediately take it. So that's an interesting way, and they are approved because they have shown results with it. I actually wanted Sanitize team to come join us as well, but somehow they engaged and then they just disengaged. Maybe they thought something in my talks was not good enough. Anyways, Clay Pot says, when will evil be defeated in the world? So Clay Pot, such an open question, and from a person who has really so if I consider how the things have been happening, never, right? Evil would always be around and the good would always be around. And I think good will have to. Today, I was remembering. So there is a bunch of people who have been putting complaints about them. From some patrons, I actually suspect who they are, husband and wife, I believe. And I was thinking about them, that the kind of issues they are creating for me and deliberately creating. And the reason was they wanted something and I didn't do it. And now they are taking their revenge. And I was sitting here and I was thinking about them and I was saying, okay, you do you and I would do me. My mother used to say there was a person who was picking up a, what is that? Uh, that little venomous thing, Scorpio. So a person saw a Scorpio drowning in the river at the river bank and he put his hand and brought it out. And the Scorpio stung him. And because of the pain, he stopped, or he opened his hand, and the Scorpio fell back in the water and he picked it up again and it would just repeat and Scorpio would sting him. And so somebody said, why are you not letting that thing go? It is stinging you. And that person said, Scorpio is doing what is his nature. I am doing what is my nature. Why should I leave my nature for his nature? So I think evil is part of the um, life. And without that, I think the concept of good doesn't become clear enough. So, good question. Um, Maziak says, please explain how, if true, false, the assertion that rapid production of IgA, 5 to 7 days following an initial infection vaccination indicates recall antibodies versus IgM taking 28 days, suggesting immune system can more quickly address COVID due to exposure to previous coronaviruses. So very good question. And yes, so I can explain it. Basically, what you're saying is correct. So let me quickly draw this. So this is the Marov story. Let's draw this part. So what we're talking about is this. Let's say if somebody is exposed to a previous coronavirus, human coronavirus, let's say, not even MERS-CoV, SARS-CoV, something, human coronavirus. When they are exposed to a human coronavirus, and this is not true for all of us, otherwise everybody who has human coronavirus, we about 80% of us have it, we would never get SARS-CoV-2. So this is not a generalizable thing. I'm just talking about a concept. Although I discussed a study in which they said that somebody who had in their recent past a human coronavirus infection, they have a better chance of lesser symptomatic or milder SARS-CoV-2 or COVID infection. So I think your question is in a similar way. So let's say somebody was exposed before, and there is some part of the spike protein that is common with SARS-CoV-2. And this exposure has caused this person's immune system, let's say B cells, to become trained to make antibodies against the spike protein. So there is training of the immune system. Now, let's say that person gets exposed to SARS-CoV-2. Again, this is a theory. If this was really the case, then everyone with the human coronavirus, which a majority of us do have, we would never get SARS-CoV-2. So I think that is not the case. So this would happen in some cases. So SARS-CoV-2 exposure occurs. When that occurs, if there is spike protein that cross reacts with this immune system cells, and that activates these immune system cells, the memory B cells, then these memory B cells would develop some IgM, but really they were already class switched to IgG. And so they would start making immediately IgG within a couple of days, 10 hours to 48 hours mostly. And then they would class switch to IgA as well. And that is how immediately IgG and IgA would start coming in, and that would start taking care of the virus, and hopefully lesser symptoms, lesser virus load, and so on. On the other hand, somebody who is naive for any of the coronavirus, and when they get the infection for the first time, now the immune system has to go through the whole set of hoops of having the innate arm work, and then adaptive arm work, and that could go on for 5, 7, 8, 10 days before the adaptive arm starts to respond. So that is the basic difference. Okay, so let's ask some live side. Observer says, funny thing about getting older, your eyesight starts getting weaker, but your ability to see through people's bullshit gets much better. Okay, uh, so Ellen, I look forward to that day that we are done with the spike protein and other things. Okay, so that's a very interesting comment. Gabriella says, according to Feng Shui, one books just behind their shoulders or in the front are considered secret arrows. Books just behind my shoulders or in the front are considered secret arrows. Please consider remove them. These problems happening to you might be related. Okay, so I can put plant over here. Thank you. Okay, so any question on the live side? There is a question here. Randolph Prince says, sorry for the question from previous show regarding S protein interfering with DNA repair. Any idea if the conformation of the S protein makes a difference to blocking repair? Conformation. So this is a very important question, and a couple of answers to this one. First of all, the spike protein impairing DNA repair has not been seen in the humans. So many people got infected. We have not developed cancers. Many people are vaccinated too. So the question, and I have this genuine question from the authors, that how much of their method is actually doable in humans? How much of that is reproducible? And there is a way to reproduce that. And somebody who is infected with COVID-19, their throat swab or some throat culture can be seen, which would have spike proteins in the cells. And if we culture them and grow them, maybe we'll be able to see if there is any anomaly. One. Second, if there are cells that are infected with SARS-CoV-2, most of them are going to be destined to die. And so their DNA is working or not is not a big problem. The only problem is if instead of dying, the DNA repair does not happen correctly, and now they become cancerous, and now they are going on their own way. But I think it's a far-fetched idea. The immune system VDJ recombination issue, and they say it in their own paper as well, that the SARS-CoV-2 does not infect the immune system cells, luckily, fortunate for us. However, the possibility is that maybe the exosomes from a damaged cell or infected cell will leak out and go into an immune system cell and kind of cause spike protein production over there. Very, it's a far-fetched idea too. So having said that, regarding as protein interfering with the DNA, is it something to do with conformation of this? So let me just very quickly um, explain what you are saying for the audience. The short answer is, in that paper, at least they didn't talk about the conformation. And what we are talking here, Randolph is saying, is let's say this is spike protein. And spike protein can be in various states. Remember the open state and the closed state. And in the open state, there is this structure, and the S1 subunit has separated, and S2 is here. And then there is a specific, it is in coiled state, and then it becomes like this. These are called conformational changes. Then we also know that the vaccine kind of some vaccines lock the spike proteins in a way that it cannot open up. So the question really is, does it matter if the spike protein can be opened up or not? And Randolph, the answer is, I don't know, because it was not addressed in the paper. Good question, though. So Roshan Naik says, considering antibodies don't prevent infection, is the idea of breakthrough infection a false idea? So I think it's really an idea of how we define something. The current definition from CDC's point of view, up till I believe May, what I forgot is May's beginning or May's end. I think it is the beginning. I may be wrong. Beginning or end. Before this, CDC had said any infection of a vaccinated person is a breakthrough infection. And after this time, I do not know here or here, they said we would only consider or investigate an infection which is after vaccination and the person is in hospital, and we'll count that as a breakthrough. So they changed some of the parameters, and they explained why they did that. So then the basic question becomes, what is the purpose of the definition? What are we going to use from that? If we just simply say what is the breakthrough definition, what is breakthrough, then there are multiple definitions. So let me explain all of them one by one. One definition that originally was supposed to be more prevalent was, let's say this is my immune system, all of it, represented as one cell. And this immune system makes antibodies. And the virus, it makes antibodies against SARS-CoV-2. And let's say, I'm simplifying it, against the spike protein of the SARS-CoV-2. And we find out that the virus has learned to escape these antibodies. It has mutated its spike protein so much that antibodies cannot actually bind with it anymore. And so this is the whole immune system. This is a new variant, almost a new strain, but let's say variant. This was a breakthrough. Virus broke through the protection. And this is technically immune systems, the virus escaped it. So that was one definition. Then the second definition became that, let's say this is the same immune system once more. Here is the virus. And now, same thing, the immune system makes antibodies. I'm simplifying it, it does a lot of things. Antibodies, and here is the virus. And the virus is trying to escape. However, immune system is still able to attack it. But by the time immune system becomes ready to attack it, let's say immune system was trained by a vaccine or a previous infection, and it became active, and it would take care of the virus. But let's say it would take 2 to 3 days for the immune system to become ready, and during that time virus has caused an infection. And in some people, that infection could be so prevalent, so spreading and aggressive, and their immune system is not ready and their body is frail, that they might actually end up in a hospital, and then they may not be able to create enough immunity or immune response to respond correctly. So this became the definition of a breakthrough. This became the definition of the breakthrough, that a person who was previously infected or was vaccinated and they got exposed again and they still developed symptoms. And we say, well, that is breakthrough. And then you saw, so in this case here, there are multiple outcomes. It is possible that this breakthrough, when the immune system actually becomes active, 10 to 48 hours, it totally resolves it or captures the virus fast. And so, very mild symptoms, and the infection is gone. Sometimes, maybe not even too much symptoms. So, that is a result of the breakthrough towards a positive side. That means immune system worked fine. It just took its normal time to become active. It is also possible that this person who had the breakthrough infection, immune system, when it woke up, by that time enough damage was done because the person was weak, let's say, that they went to a hospital or even became too severe, died. This is also possible that this breakthrough caused the immune system never to ramp up to enough levels to respond at all, and they went to hospital and or died. That is because their immune system was weak, or they had a cancer, or they were using immunotherapy, and so many other reasons. So that means here we can't say this is breakthrough or this is breakthrough. We simply said if the virus is able to land and cause infection, we are calling it a breakthrough. Then you saw so this was more technical definition. This became more prevalent definition. This is the definition that media picked up and said, here we have so many vaccinated and they still have infections, we have breakthroughs. Then CDC first went with this kind of a definition, then they changed it to this, that anybody who would be in the hospital, we would consider that to be a breakthrough. And so that became the definition. And so now, if I go back to your question, considering antibodies don't prevent infection, um, is the idea of breakthrough infection a false idea? So, no, it is still false. The definitions are just various. Ellen says, yes, she's correct about the books, and open shelves are not good behind you. Thank you very much. Now, I just remembered Luffy's outside today. I don't know if my wife went and brought him back or not. Okay, so let's see. Widget the Mermaid said or says, are there any studies of COVID Delta variant, natural immunity versus vaccinated immunity? Would natural immunity be better since the vaccine is designed for resistant COVID-19? Thanks, Mermaid Being. It's a good question, but Delta has not changed enough that previous exposure to the other viruses or vaccines exposure to the previous made for the previous virus or Alpha or Wuhan virus, actually, there has not been enough of a change. So, and just for us cool beans to be a little more accurate, because I see some folks on Twitter making fun of people saying natural immunity. This is correct, that vaccine also creates natural immunity and infection also create natural immunity. I think in a more day-to-day discussions, we use natural immunity to mean immunity acquired after the infection versus immunity generated by the vaccine. But anyways, to answer your question, are there any studies of COVID Delta variant natural immunity versus vaccinated immunity? There are studies, and you can actually see there are studies which I discussed, for example, Kentucky study, which said vaccination is better in protection than previously infected people. There is a study from Israel a few days ago that I shared, which said um, previously infected people have 13 times better protection than vaccinated people. So I guess these studies would continue to come in. Some would say this is better, the other would say this is better. I think we should keep our eye on the ball, and the ball is protection from severity and death. Protection from case is never going to work very correctly. Neither do we have good testing methods, nor can we test everyone. There are so many asymptomatic cases, and then everyone has a different, demography, and so case numbers is an interesting data which I don't think would ever become synchronized correctly. So Rogaru says, must remember the vaccine do not produce immunity to the virus, only through spike. So again, the question is, what do we mean by immunity? If we are saying the point we are trying to make is that the vaccine is given so that the virus cannot take hold or cause severe disease, then this is immunity against the virus. On the other hand, if you say structurally a person who got infected by the virus would develop antibodies to more parts of the virus, and a vaccine developed immune system would only develop antibodies against spike protein of the virus, then that is correct. So, Gabby, this is a good question. I don't know the answer. Even this paper that I discussed today, in that paper, they said, they kind of thought aloud, and they said, those who develop pericarditis, let's say after the first, or myocarditis after the first dose, what should they be doing? Should they get the second dose? Should there be an increased interval of the second dose? Is one dose sufficient? And then they responded and they said one dose is not shown to be as efficacious as two doses. So we have some data from UK that because when they increase the time between the two doses, at least at that time, uh, Oxford, AstraZeneca, right? For that, they did the study and they said it actually slowly kept increasing the efficacy, but it never went above, I think, 84. Then the second dose, when it was given, then the efficacy ranged in 90s. So it seems like a lesser efficacy compared to two doses. The question would be interesting to say Moderna's efficacies versus Pfizer's. And there it has been shown in studies that Moderna's efficacy is more than the Pfizer's. Okay, so John Doe has a very good question. Won't breakthrough infection then always be possible based on the amount of exposure? Yes, that is the point. It's a respiratory virus. I have been saying it throughout the last year as well. Even with the vaccine, or even if somebody was previously infected, they cannot put a stop here to say virus should not land in that person's mouth anymore because they're vaccinated or previously exposed. It's a respiratory virus. It can arrive in a person's mouth or nose or eyes without any issues. The question is, how would then we respond? Would it take hold? Immune system would take a couple of days to become active. If it is already active, then we would not even know. For example, somebody had a booster 3 days ago, or somebody had a previous exposure and are still going through the infection. So in such cases, they would not even know more virus came in. So what? But if the immune system had gone to rest, then it would need to wake up. So yes, you're correct that infection would be the breakthrough, and that would be for a few days, and it depends upon the amount of exposure. It depends upon the person's immune system status, their body status, their nutritional status, their diabetes status, their obesity status, hormonal balances. All of that would account in. It's not 100% answer to say previous exposure and now this should be happening, or this should not be happening, or a vaccine and now this or that should not be happening. It's a respiratory virus. And so this is interesting for me that people just keep in media, they just keep fighting about this, but really from a mechanism point of view there is no fight. So you are saying it correctly. Okay, so Ellen says, "Nice play button, Dr. Bean. I got mine 2 weeks ago. Very good. Congratulations. Very good. You should invite us to um, your channel someday. We'll all come over there." Okay, so how about we do this? This is still a new setup, and I still am not very comfortable with the way I put my arms here. This is why I keep changing my posture. So, how about we stop for today and we will continue tomorrow? So, please, if you like this work and if you would like to support it, the easiest support is like, subscribe, and share. Even in that, the easiest is like and share. And if you would like to support more of this work, then there are links in the description. You can be a patron, or you can use PayPal, or you can buy me a coffee. Thank you very much, and I would see you tomorrow. Bye bye.